The death toll Canada has euthanized. Welcome to Wake Up Canada News. I'm Brent Wilder. This next article was researched and written by Frank Bergman. Canada has euthanized around 90,000 people since Prime Minister Justin Trudeau's Liberal government legalized so-called medical assistance in dying, or MAID, back in 2016. The death toll was exposed in a shocking data report published by Euthanasia Prevention Coalition, the EPC. Their executive director, Alex Shandenberg, revealed the grim total, citing government data and projected 2025 figures. There were around 16,500 Canadian euthanasia deaths in 2024, representing 5% of all deaths, Shandenberg declared. There have been around 90,000 Canadian euthanasia deaths since legalization. Shandenberg based his projections on official numbers from Ontario, Quebec, Alberta, and even British Columbia. Now, since Ontario, Quebec, Alberta, and even BC represent 87% of Canada's population, and since there were 1,056 more euthanasia deaths in those provinces in 2024, and even since there were 15,343 reported euthanasia deaths in 2023. Therefore, it's safe to predict that there were around 16,500 reported euthanasia deaths in 2024, he explained. The watchdog noted a 7.5% surge in euthanasia deaths across the four provinces between 2023 and 2024. By the end of 23, the government had already counted 60,301 deaths by lethal injection. I'm predicting that there were approximately 16,500 reported euthanasia deaths in 2024, Shandenberg said. Therefore, as of December 31st, 2024, there were around 76,800 reported euthanasia deaths since legalization. Now, since this article was published in late September of 2025, it is likely that there have been around 90,000 Canadian euthanasia deaths since legalization, he concluded. Healthcare failure driving Canadians to death. Yes, behind the staggering death toll lies a grim reality, as Canada's collapsing socialized healthcare system is driving the sick and elderly towards euthanasia as an alternative to treatment. Wait times to see a specialist in Canada have soared to an average of 27.7 weeks, leaving desperate patients with a cruel choice to endure worsening illness or seek state-assisted death. That was the fate of a 52-year-old grandfather, Dan Quayle, from British Columbia. Quayle was euthanized on November 24, 2024, after being denied cancer treatment due to a waitlist delay. In another case, a Winnipeg woman who ended her life through assisted suicide wrote in her obituary, "I could have had more time if I had more help." Disturbingly, critics note that those who refuse euthanasia are increasingly shamed as selfish for not relieving the system of their burden. Liberals expanding death instead of care. Well, rather than fixing Canada's medical crisis, the left-wing government is expanding euthanasia access. In February 2024, after backlash from pro-life, medical, and even mental health groups, as well as opposition from most provinces, Ottawa agreed to delay its plan to extend euthanasia to those suffering from mental illness until 2027. The plan was delayed after large numbers of doctors refused to euthanize mentally ill patients who were otherwise healthy. Yet the Liberals are also moving on extending euthanasia to children, raising further alarms about where the program is headed. Covering up a leading cause of death, yes, euthanasia is now ranked as the 6th leading cause of death in Canada. However, since Statistics Canada is not listed among its nation's top 10. Instead, the agency counts only the illnesses that led patients to request assisted suicide, not the lethal injection itself, as the cause of death. Critics warn this accounting trick hides the shocking truth. Canada is killing its citizens at an unprecedented rate, while the government continues to normalize and expand the practice. Thanks for watching Wake Up Canada News. Please like, share, and follow us on any of your favorite socials, including Facebook, YouTube, Rumble, BitChute, and our website at wakeupcanadanews.com. Till next time, remember you're the voice, and it's time to make it count. I'm Brad Wilder. I'll see you soon.